Welcome back to the approval process, the podcast from How to Get Approved. I'm Sophia Sparks, pharmacist.
And I'm Julian Ray, professional question asker.
Did you know that Medicare Part D doesn't technically cover weight loss medications? But here's the twist. Wegovy, a drug often associated with weight loss, can sometimes be approved. Today, we're breaking down exactly how that works.
Right? Because I think a lot of people assume that if they have Medicare and their doctor prescribes Wegovy, they're good to go. But clearly it's not that simple.
Not at all. Medicare Part D has a federal exclusion for medications prescribed solely for weight loss. That's the rule. But Wegovy has other FDA-approved uses, and that's where things get interesting. If it's prescribed for one of those approved indications, Medicare Part D might cover it.
So if someone has obesity or overweight, that alone isn't enough to qualify for coverage under Medicare Part D?
Exactly. Obesity or overweight by itself doesn't meet the criteria. Instead, the medication has to be prescribed for a specific purpose that Medicare allows. There are two main scenarios where this might happen, and we'll go through both.
All right, let's start with the first one. What's the first situation where Wegovy might be covered?
The first situation is when Wegovy is prescribed to reduce cardiovascular risk in obese or overweight patients who already have established atherosclerotic cardiovascular disease, also known as ASCVD.
ASCVD. That's a lot of syllables. Can you break that down for us?
Of course, ASCVD stands for atherosclerotic cardiovascular disease, which essentially means someone has disease caused by plaque building up in their arteries. This can include conditions like a previous heart attack, a stroke, blocked heart arteries, or peripheral artery disease. So, this isn't about preventing someone's first heart attack. It's about lowering the risk of another serious cardiovascular event in someone who already has cardiovascular disease.
Got it. So if someone has never had heart disease, this particular indication wouldn't apply to them?
You are right. This is specifically for people who already have established cardiovascular disease and are also overweight or obese. Wegovy can then be prescribed to reduce their cardiovascular risk, and that's what Medicare Part D may cover.
All right, so that's one situation. What's the second?
The second situation involves a liver condition called MASH, which stands for metabolic-associated steatohepatitis.
Is that the same thing as fatty liver? I feel like I've heard that term before.
They're related, but not exactly the same. Think of it this way. Fatty liver happens when fat starts building up in the liver, but not everyone with fatty liver has problems. For some people, though, that fat causes inflammation, and the liver starts getting injured. Over time, the body tries to heal that injury by creating scar tissue. Too much scar tissue makes the liver stiffer and less able to function properly, and that's MASH.
Okay, so it's like the liver is trying to repair itself, but the scar tissue ends up causing problems instead.
Exactly. And for Medicare Part D coverage, Wegovy may be approved for patients with non-cirrhotic MASH who have moderate to advanced liver scarring, what's called F2 or F3 fibrosis.
You're going to have to explain that fibrosis scale for us. What do F2 and F3 mean?
Doctors measure liver scarring on a scale from F0 to F4. F0 means no scarring, F1 is mild scarring, F2 is moderate, F3 is advanced scarring, and F4 is cirrhosis, which is the most severe. For Medicare Part D to cover Wegovy for MASH, the patient needs to have F2 or F3 fibrosis. That means they're sick enough to have significant liver damage, but not so advanced that they've reached cirrhosis.
Got it. So the sweet spot for coverage is somewhere in the middle. Not too mild, but not too severe either.
Exactly. And that's an important distinction because it helps define who might qualify under this second indication.
All right, so we've covered the two main situations where Wegovy might be approved under Medicare Part D, cardiovascular risk reduction, and MASH. But I know there's a lot of confusion out there about the different formulations of Wegovy. Can we talk about that?
Absolutely. This is such an important point. Today, we're specifically talking about Wegovy, not Wegovy HD. Wegovy HD is approved only for weight management, which means it generally wouldn't be covered under Medicare Part D because of the exclusion for weight loss medications.
So if someone's prescription says Wegovy HD, they're probably not getting it through Medicare Part D?
Correct. However, there are other programs, like the Medicare GLP-1 Bridge program, that might cover Wegovy HD under certain circumstances. But that's a topic for another day.
Got it. And what about Wegovy tablets? Are those covered under Medicare Part D?
Good question. The tablet formulation of Wegovy may be covered under Medicare Part D when it's prescribed to reduce cardiovascular risk in patients with established ASCVD who are overweight or obese. However, the tablets are not approved for the MASH indication, so they wouldn't qualify under that diagnosis.
So the formulation really matters. Whether it's the injectable version, the tablet, or Wegovy HD, it's not just about the drug itself. It's also about the specific diagnosis and indication.
Exactly. And that brings us to another key point. Even if someone meets all the criteria, their doctor can't just write the prescription and call it a day. Most Medicare Part D plans require prior authorization.
Right? And that's where the documentation comes in. What kind of information does the provider need to include?
The provider needs to document why Wegovy meets the covered indication. This often includes the specific FDA-approved indication being treated, whether the patient has established ASCVD or non-cirrhotic MASH with F2 or F3 fibrosis, and proof of obesity or overweight status. The more complete the documentation, the smoother the approval process tends to be.
It sounds like getting approved is as much about the paperwork as it is about the medication.
That's absolutely true, and it's why understanding the rules and working closely with your healthcare provider is so important.
All right, let's wrap this up with some quick myth busting. I'll throw out a statement and you tell me if it's a myth or a fact. Ready?
Let's do it.
I'm obese.
Myth. That alone isn't enough for Medicare Part D coverage.
I have Medicare.
Myth. Just having Medicare doesn't guarantee coverage.
My doctor prescribed Wegovy.
Myth. Even with a prescription, coverage depends on the diagnosis and documentation.
I've had a heart attack and I'm obese.
Fact. That may qualify if Wegovy is prescribed for cardiovascular risk reduction and other plan requirements are met.
I have non-cirrhotic MASH with F2 or F3 fibrosis.
Fact. That may qualify if the prescription matches the FDA-approved indication and the plan requirements are met.
All right, final takeaways. What are the 3 most important things people should remember from today's conversation?
Number 1. Medicare Part D generally does not cover medications used only for weight loss. Number 2. Coverage depends on the diagnosis, not just the drug itself. And number 3. Complete documentation from your healthcare provider is one of the biggest factors in getting approved.
That's a great summary. Today's episode really drives home the point that getting approved isn't just about having the right medication. It's about understanding the rules, having the right diagnosis, and making sure all the paperwork is in order.
Exactly. If this episode helped you better understand how Wegovy is covered under Medicare Part D, share it with someone who could benefit.
Thanks for listening to the Approval Process Podcast from How to Get Approved.
We'll help you get approved. See you next time.